Welcome to the Human Meme Podcast. I'm AI David Bowles, and along with our crackbot AI research team, we have investigated this topic for you today. Revolutionizing healthcare. How medical AI is shaping the future of medicine. Medical AI is not just a technological leap. It's a cultural shift. When machines analyze our health, we enter a world where the expertise of algorithms supplements, and sometimes challenges, the wisdom of clinicians. This isn't about replacing the human touch, but redefining it. The real story of medical AI is how it pushes us to rethink the relationship between technology, health, and humanity. Take the Sense to Know app, a trailblazing example of how AI can democratize healthcare. It uses machine learning to assess toddlers for early signs of autism based on facial expressions, gaze patterns, and interactions during a game or video. Think of what this represents. Previously, autism diagnosis required specialized clinics and extensive observation, often delaying intervention. Sense to Know brings this capability to anyone with a smartphone. That's empowerment. However, innovation brings challenges. The app, for all its promise, highlights the dual-edged nature of technology. First, there's the potential for bias. If the training data doesn't adequately represent diverse populations, the algorithm could misdiagnose children from underrepresented groups. Second, accessibility is key. While Sense to Know reduces geographic and financial barriers, it still relies on caregivers having access to compatible devices. An assumption that doesn't hold universally. But AI's application in medicine extends far beyond diagnostics. Consider AI ECG, a tool designed to detect and prioritize treatment for heart attacks, specifically ST elevation myocardial infarction, RSTEMI. Time is muscle, as cardiologists say, and reducing delays in treatment saves lives. In trials, AI ECG not only improved diagnostic accuracy, but also significantly shortened the time from emergency room admission to intervention. It's the kind of efficiency that can transform outcomes. Yet, the story of AI ECG is also a tale of integration. AI didn't act in isolation. It worked alongside physicians, notifying cardiologists of potential STEMI cases, and streamlining their workflow. This underscores a critical point. Medical AI is most effective when it augments human expertise, rather than trying to replace it. The best outcomes arise when humans and machines collaborate, leveraging each other's strengths. Let's pivot to the elephant in the room. Trust. Trust is the foundation of healthcare, and it must extend to these new technologies. How do we ensure that an AI system is accurate, unbiased, and safe? For starters, transparency is vital. Clinicians and patients alike need to understand how these algorithms work, what data they're trained on, and their limitations. Bias is a particularly pressing issue. If an AI system is trained on data predominantly from a specific demographic, its accuracy may falter when applied to others. For instance, an algorithm trained on predominantly Caucasian populations might miss critical health indicators in Black or Hispanic patients. This isn't just a hypothetical risk. It's a reality that has been documented in multiple studies. The solution? Diverse representative data sets that reflect the populations these tools are meant to serve. Another concern is privacy. As AI swings into genomics, imaging, and real-time patient data, the need for robust safeguards against misuse becomes urgent. Data breaches in healthcare are not new, but with AI, the stakes are higher. We're not just talking about social security numbers or insurance details. We're talking about deeply personal health profiles that could be used to discriminate or exploit. Then there's the question of accountability. Like, say, who's responsible when an AI makes a mistake? Is it the developer at fault? The clinician who relied on the tool? The hospital that implemented it? These are ethical and legal gray areas that the medical community and policymakers must address before these tools become ubiquitous. But let's not lose sight of the potential. AI can do what no human can: process vast data sets in seconds, uncover subtle patterns, and learn continuously. Imagine AI systems that predict disease outbreaks based on environmental data, analyze genetic markers to recommend personalized treatments, or monitor chronic conditions through wearable devices that provide real-time updates. Consider digital phenotyping, an emerging field that uses AI to analyze behavioral and physiological data to understand mental health. For example, AI can detect patterns in speech, movement, or sleep that signal the onset of depression or anxiety. These insights can lead to earlier interventions, often before the individual themselves recognizes the symptoms. Medical AI also shines in addressing inequities. Telemedicine powered by AI can reach underserved areas, providing remote diagnostics and even basic treatments. For example, AI-driven mobile apps can diagnose skin conditions or eye diseases with just a photograph, allowing patients in rural or low-income regions to access care they might otherwise lack. And yet, for all its promise, AI is no panacea. It cannot replicate the compassion of a doctor breaking difficult news, or the reassurance of a nurse holding your hand before surgery. Medicine is as much about connection as it is about correction. Technology can enhance care, but it cannot replace the humanity at its core. So where does that leave us? At a crossroads, as always. The future of medical AI depends on us, on how we design these tools, how we regulate their use, and how we choose to integrate them into our lives. It's a delicate balance of innovation and caution, ambition and humility. Medical AI isn't just about smarter machines, it's about smarter systems, smarter policies, and ultimately, smarter societies. If we get it right, AI won't just change medicine, it will elevate it, making care more precise, more accessible, and more human. So, as we look to the future, let's ask the hard questions, demand the highest standards, and remember that at the heart of all this technology are people, patients, caregivers, and the medical professionals who serve them. AI can do amazing things, but it's up to us to ensure it does them in the service of us all. For the Human Meme Podcast, I'm AI David Bowles, wishing you a safe evening and a healthier tomorrow. Be a human meme.
In the mind, we are